So what's been my training background and experience since I decided to embark on a career in ophthalmology? Well, early on I read an article by Sir Magdi Yacoub, the renowned cardiothoracic surgeon, and he talked about, in his training, seeking out the very best people he could to study with and work with in order to learn as much as possible and integrate it all into his practice. And that stayed with me, that idea. And I was really fortunate with my first ophthalmology post at the Sussex Eye Hospital in Brighton. I had excellent teachers, given excellent training in surgery right at a young age, which really set me up for this virtuous circle of continuing surgical experience. Because I was well taught in the beginning, that meant I became a competent eye surgeon very early on, which meant that every job I then went to, whoever was supervising and teaching me said, "Oh wow, you can do this. Oh fine, well, great, you can do this then." And they'd give me more complex work and they'd give me big lists. And so it just fed into this virtuous circle of increasing surgical experience. And then I just chased the very best jobs and the best experience that I could around the world. So I was lucky to work in Reading and then at the Oxford Eye Hospital. And then I worked with the surgeons here in Yorkshire on the registrar rotation. And there were some amazing teachers in that surgical experience. And then I was fortunate to head off to Australia for a year and work with Graham Barrett, who is a genius. He just is. He's an innovator. And so to be able to spend a year just picking his brains and understanding more about optics and about how we try and deliver improved outcomes for our patients was incredible. And then to round it off with time at Moorfields Eye Hospital. It's the world's largest eye hospital, so you want to spend some time there just because of the caseload, the number of cases coming through the door, but also some incredible surgeons there, and it was a real privilege to work with them. And then I was ready, and actually I was really ready. I wanted to be an independent practice. I wanted to be a consultant. So I was delighted when I was appointed as a consultant here in Leeds, and I really enjoyed 10 years working full-time in, well, one of Europe's largest teaching hospitals and certainly one of the busiest eye departments in the country, dealing with a really complex caseload of complex cataract and corneal pathology. And I've really enjoyed the work that I've undertaken with Andy Morel over the last 10 years, where we managed to set up a really effective and safe and successful laser eye surgery service, St James Laser Vision. And I still really enjoy using the technology that we've put together there. And I still really enjoy seeing the beneficial impact we have in improving the quality of people's lives, both in our, let's call it cosmetic practice, decreasing people's dependence on spectacles, but also in our therapeutic work, treating painful conditions and curing blindness in patients with corneal disorders. So yeah, it's been a great journey, and I'm still enjoying the ride.